Ladies and gentlemen, he's a hometown boy now, or he has been for 15 years. Please welcome Dr. Mike Carter.
Thanks, Phil. It's an honor to be here, and as you said, I did train with Larry Goldenberg. He was one of my professors at UBC, and it's a great honor to be on the same stage with him at this point in my life. Stacy and I were undergrads together, and we used to spend many nights in the library studying. And Stacy really is a world authority on sexual dysfunction, and it's great to see that she's done so well. And Christina, who you're going to hear about, is a wonderful resource to have in Kelowna, and it's an honor to work with her too. So I'd like to thank Pfizer too, Javi, for sponsoring this. It's a great event and a tremendous idea, and certainly the time has come for this sort of an initiative, and I congratulate Larry for the work that he's done in this regard. Larry was quite concerned when we booked this that it might conflict with a Vancouver Canucks hockey game, and I assured him that that wouldn't be the case. And as it turns out, I was right. So, as Phil said, I'm a urologist, and it's my fault. Yeah. It's that goalie they paid $10 million a year, I think, isn't it? So I like to start talks on sexual dysfunction with this slide, which I call Carter's Law of Physical Pleasure. And it's a graph of age versus physical pleasure from bowel movements and sex. You can see that when you're in your 20s and 30s, sex is very important. Bowel movements, not so much. But as we get older, the crossing point's at about 62 there, I think. And this is obviously facetious, but as Stacy said, men, there's no reason that men shouldn't have an active sex life well into their 70s and 80s, and that's one of the things that we're aiming for here. So I'm sure Christina's going to talk about part of this, but I just wanted to, allude to the fact that erectile dysfunction and sexual dysfunction are quite different. And as urologists, we talk about erectile dysfunction mostly, which is the mechanics of having an erection, as Dr. Elliott described. But really, it's part of the umbrella of sexual dysfunction, which is a much broader category that involves a lot of different aspects. So, as Dr. Elliott said, erectile dysfunction is the inability to consistently initiate and maintain an erectile response adequate for vaginal penetration. It can also be related to penile curvature problems. That can be trauma, something called Peyronie's disease, which is an abnormal fibrotic condition of the penis that leads to curvatures, which can actually, even though the erection may be good, can actually preclude vaginal penetration, and in a sense, men are unable to have intercourse. There's also a congenital condition where one of the corporal bodies, you remember from Dr. Elliott's talk, those two cylinders, one can be longer than the other on a congenital basis, and I saw a 27-year-old man in my office the other day actually that had this, and this leads to a penile curvature as well, and he's actually never been able to have intercourse because of this, and the results are, the treatment is surgical, and the results are really quite gratifying, but again, it's one of the things that younger men are often shy and reluctant to go to their doctors about. So that's erectile dysfunction. That's what urologists tend to deal with mostly. There's some pretty, with the PDE5 inhibitors that Dr. Elliott talked about and some minor surgical procedures, the treatment for that is fairly effective. But that, as I said, fits into the umbrella of sexual dysfunction, which is a much broader topic. There's libido issues, which are brain issues. Testosterone has a function in that, but there's a lot of other things that go on there that we don't really understand in terms of libido or sexual interest. As Dr. Elliott said, if both partners don't really care, it's not a problem, but if one partner does and the other doesn't, then it can be an issue. And often these are very difficult things to address. Orgasm, which is also a cerebral phenomenon, is something, again, we don't really understand. We think something happens, some reflex in the frontal part of the brain happens for orgasm, but we don't really understand that, and there are difficulties with men achieving orgasm, having problems with orgasm. And then there's ejaculation, which refers to the actual emission of seminal fluid through the urethra, and there's all kinds of different problems that can be related to ejaculation, premature ejaculation is relatively common, but men can have delayed ejaculation. They have trouble actually achieving ejaculation. They can have painful ejaculation. They can have retrograde ejaculation. So instead of all the fluid coming out, it goes back up into the bladder, and that can often result, I'm going to talk about as a result of some medications and some surgery that we perform. Ejaculation can be absent or reduced in volume. Men notice this as they get older, partly as a result of lower testosterone levels often, but also, I think, as a result of prostatic enlargement. And finally, bloody ejaculate, or something called hematospermia, is quite common. It doesn't really cause any problems, and it's not certainly a sign of anything serious, but men can often be quite alarmed when they see this, and it can lead to some sexual dysfunction orders. One of our professors, it is a completely benign symptom in and of itself, and one of our professors, Dr. Ankerman, used to say, if it's a persistent problem, just tell the guys to turn the lights out and not look. So I'm going to talk about sort of the implications of prostate disease and its treatment on sexual function. And there's really three categories of prostate disorders that can occur. Prostatitis, which is an inflammatory condition of the prostate. Everybody's heard of BPH, or benign prostatic hyperplasia, where the prostate enlarges and causes voiding issues in some men, or prostate cancer. So the mechanisms can be psychological. Men with prostate cancer, often when they're first told they have prostate cancer, are obviously upset and they're concerned. Some men are concerned that they're actually going to transmit something to their partner, some form of malignancy to their partner. So that can have a bearing on your overall well-being and cause sexual dysfunction. The medical treatments that we use for some of the prostate conditions can cause problems, as can some of the surgical treatments that we offer patients. So this is an image of the prostate. I don't have a pointer, but the prostate's kind of in the middle of the screen there. And you can see its intimate relationship with the penis, the urethra, the bladder. Those are the seminal vesicles, the vas deferens, the nerves, the blood vessels. It's certainly not surprising to see that treatment and conditions of the prostate can have impact on a man's sexual function. The prostate itself serves really only one useful purpose in life, and that's to provide Dr. Goldenberg and I with a good income and keep our wives and children fed and happy. So I'll talk a little bit about prostatitis first. Prostatitis is a relatively common condition. It's quite common in younger men as well. It's a bit of a grab bag term, the term especially chronic prostatitis. It used to be thought that it was an chronic infectious problem of the prostate. Most cases are probably not infectious. They may have started off as an infection, but there's something else going on. There's an inflammatory condition of the prostate, and I use the analogy to patients. It's kind of like an arthritis. Arthritis is inflammation of a joint, not usually related to infection. This is kind of inflammation of the prostate, and it can cause a variety of symptoms, most commonly pelvic pain, voiding difficulties, testicular pain, pain down backs of men's legs. It's sometimes called now, because many people feel that it's actually not, in fact, a purely prostate problem. There's more of a pelvic floor problem, so they've coined the term chronic pelvic pain syndrome of men. It definitely has a negative impact on a person's quality of life. It tends to be a chronic problem that's not easily treated, and anything that has a negative impact on the quality of your life is going to have a negative impact on your sexual function. The two most common things that men report, though, low libido, low sexual interest problems, and ejaculatory pain. I think that there definitely is something going on. These guys aren't crazy. We just don't have a good handle on what the problem actually is.